Hello and welcome you with India Post Live, India's first online news conversation portal. And welcome to the conversation. I'm Ishan. Today we are talking about selfies. Yes, move over Generation X, move over Generation Y. The time of the millennials is here. And that has meant an obsession with an individual. How is that obsession becoming very dangerous? Have a look at the story.
If it was drug addiction earlier, it's now the selfie that has become an obsession with the youngsters. The selfie obsession has now been recognized as a mental disorder by the doctors. After spending 10 hours and clicking over 200 pictures, 19-year-old Danny Bowman realized he had not got the perfect picture. The teenager attempted suicide in the UK. This incident has revealed the fault lines in the online social media.
Because of increasing peer pressure now and the social sites and media awareness, most of the patients they are coming a decade early now.
Indians are not far behind. The selfie and looking good trend is becoming a rage.
I want to change my smile because I often don't smile.
People click to get it uploaded on FB. So yeah, in today's world, everyone wants to look good. They want to look smart, beautiful in front of others. So and pictures play a very big role in today's life.
I can remove my scars. That would do nothing else. Eyes. If there's anything to get into my eyes, like make it bigger or something, I make it look further.
I feel like pics should be more appealing, so I take more and more selfies. So I can take the best selfie on Facebook or WhatsApp.
Plastic surgeons and hair transplant clinics are not complaining either.
Women clients generally we have if we take in a ratio 1 to 10, we generally receive around 1 or 2%. And generally they come for eyebrows if they have a very thin eyebrows or if they have any scarring in the eyebrows.
Good looks matter even if that means simply being online. And it's only a matter of time before the selfie bug bites you if it hasn't already.
All right, and you too can join in the conversation. Of course, log on to indiapostlive.com. You can go post your video comment over there. You can post your comments over there. Also, as far as Twitter is concerned, hashtag IndiaPostLive is where you can go and post your tweets. Dr. Lalit Chaudhary joins us on this conversation. He's a consultant plastic surgeon and cosmetic surgeon at the Sir Ganga Ram Hospital. Dr. Chaudhary, why this obsession? Is it because society is completely changed, an individual-based society where projecting one's image has become all-consuming?
We commonly see now everybody, it is not like earlier we used to have a fixed role models which people wanted to mimic. It is the social media and awareness with the other media which has increased their patient have more self-image fixation. Now they want to mimic somebody which they think they should be and they are not able to do it. So mainly because of the peer pressure to be in front of the lane of the other people who are along with them. And secondly, with the social media awareness, they are continuously having access to not only just on the laptops but on the phone and everywhere they can access. So we find that because of the more awareness and the highly competitive world, so they want to look as a different individual. So the extra thing which they can do is to have a look which is different, which everybody wants to get in.
So just to get that popularity, just to get those Facebook likes, or just to
more eye-catchy maybe.
More eye-catchy, but where does this end? I mean, a recent study, in fact, has found that many people, especially in the US, most of the people going in under the knife are people under 30, and isn't that a worrying trend? That perhaps shows low self-esteem, that also shows that obsession, but medically, how dangerous is that?
See, what we see that if you count the population of our country, if 1% there is not 1% here. So we have a larger group for every 1% here in India. So we see it starts from early age, as I have earlier also mentioned sometime that before normally we are not offering cosmetic surgery for the patients who are under 18, who are not adult, to take their own decisions. But we do find that before they enter the college, they find that their parents are bringing the patients, their children to us, saying that it is affecting their studies. So we find that even in the early teens or middle teens, they are also having the same concept which Otherwise, we expect them to have in 20s. So they do come to us for not just the facial surgeries, but also for the other part of the body to be more acceptable, and the things will not affect their studies and they perform better. Not just that, once they enter the college, they will have the feeling of rejection if they are not having
Kids under
particular.
18 are coming in and the parents are getting them in.
Under 18, the parents are getting them. After 18, the patients are coming by themselves. Now
But isn't that worrying? I mean, that is what conventional wisdom says, that the human body, I mean, till the time you're in your mid-20s, your body is still growing. And I mean, if you go under the knife, is it safe?
See, going under the knife is under the control of the surgeon. I think we should make them realize that this is not their realistic expectation. And there are few things like you cannot do a rhinoplasty before 18, you cannot do a breast surgery before 18, that they must be told beforehand on the face. And if required, a psychologist or a psychiatrist can help them out. Now, because these organs are not mature till that time, and if we do it early, then the growth will interfere. They will be interfering in the growth. So that is one aspect of it.
All right, interesting point you make over there. We'd like to remind our viewers that you too can, of course, join in the conversation. IndiaPostLive.com is the website. Just go over there, post your video comments, post your comments other than your video comments if you have any. Also, you can log on to Twitter and tweet up to us. IndiaPostLive, hashtag IndiaPostLive is, of course, the hashtag that you can use to join in the conversation. Dr. Chaudhary, also, I want to talk about these surgeries. I mean, it almost seems that it's becoming an addiction, so to say, and that is perhaps scary because an entire generation is getting into this, and for the future generations of this generation, it means that everybody would not look as they were born.
You see, a more number of people are now going, maybe because of peer pressure or other reasons, that they are going to gyms also. Now they are self-conscious of their body image. Not in 20s, even in the early age group, in the school time also they are. So that is the reason they search the net and they find the things which are in thing, kind of the language they use it.
All right. We also have a viewer coming in on Skype. Hi, thanks very much. If you could, Zorian Cross comes in on Skype. Zorian, if you could just tell us your comments as far as this selfie obsession that the millennial generation seems to have had.
Well, I don't think it's really a new obsession. I think taking a picture has been an obsession since the camera was invented. And just technology has made it more portable for everyone to do it. I mean, would you really call it an obsession if you look at ancient art with the Renaissance paintings and look at the ancient Greek and Roman art?
But once that obsession leads to perhaps wanting physical change, wanting to look different from what you actually are, then that could become a problem, isn't there?
Well, first of all, it's never been that way that it's a new thing. This has been going on for decades and even centuries. Secondly, I think the biggest issue is not about getting plastic surgery. It's about addressing people's body dysmorphia, which is an actual psychological defect which a lot of people have. But it goes unrecognized, especially in India, because there's no literature about it. But in the West, it's a very well-recognized disease. Furthermore, I mean, would you really call someone like Mahatma Gandhi vain and obsessed because his selfie is on every currency note we have in our country?
Not out of his choice, I would put it there. But Dr. Chaudhary, you would want to respond to that. As far as the psychological disorder goes, is there awareness in the medical community? Is the medical community, because many a times it is often alleged that doctors also or the medical practitioners do it for the money rather than do it for the patient's benefit.
Well, first of all, I think it's about educating people about this because as it is, we live in a country where people would rather do a puja than actually go to a therapist for anything mentally.
That's why we're asking this to the doctor over here. Dr. Chaudhary, go ahead.
I think
exactly. And
what is most important is that we must understand the reason why patient is coming to you. And second, it is not necessary that because of that reason only you will operate on him. The operation depends upon whether the patient's expectation is realistic or not. Second, it is not going to interfere in his normal routine life. Like if you ask for a breast job in 14 years of age, I will not do it. Only after 18, I will think of doing it after I'm convinced that the patient is having a realistic expectation. So that must be patient education is very important. Consultation is very important for a longer time, maybe
But
half
the
an hour.
awareness in the medical community is it there about the psychological side of it, the aspect of
It is there, very much there.
Then how do you explain all these clinics coming up, and do they, I mean, and often it has often become a money making racket. I mean, I'm sure that there are doctors who are out to do good, but at the end of the day, the monetary aspect of this entire issue cannot be ignored.
I don't know exactly, but there might be few of them might be doing. I don't know exactly, but in my hospital we never encourage it.
All right, Zorin, before I come back to you, I just want to get in a comment that has come in on our wall on India Post Live. Joseph Alexander writes in, what are the side effects of surgery, of any kind of surgery, plastic surgery, doctor?
See, side effect of any surgery is going to be 1, 2, 3, 4. You can count. It is well written everywhere. What is more important is that for what patient is coming, then he must know that it is like somebody is coming with a photograph that he wants to mimic like him. So that is a unrealistic expectation. Now, if somebody has a tilted nose, obviously that can be corrected. But if he wants to mimic somebody in the Hollywood or Bollywood, that cannot be done. So those things actually we must tell the patient on the face, and if he is not agreeing, we can always refer him for evaluation to either the second opinion or to the concerned psychotherapist or a psychologist or a
counselor. Zorin, you wanted to come in with a comment?
Well, basically, like I was trying to say earlier, it's like at the end of the day, we need to understand that there's a difference between artistic expression and there's a difference between vanity. I mean, selfies are a form of artistic expression at the end of the day. We all want to put our face out there. That's the way the culture has always been throughout. It's not just a new thing, just technology has changed. But what I would say is that, rather than going on the plastic surgery route, it's important for people to understand what makes them unique. Why do they want to be that way and put their face out there? Because their face is what's going to get them recognized, be it on Facebook, be it Twitter, be it anything, especially now in the digital age. But what's important is, how far are you willing to go about it? And when it's coming down to a surgical level, especially when it's a teenager, that's when parents need to really take into consideration what's going on psychologically.
Absolutely, and the surprising thing is, and Dr. Chaudhary was telling us a bit earlier, that it's often parents who bring their children under 18 to get these surgeries done because of suffering from low self-esteem. The kids are made fun of in school if they have some kind of a defect. It's not that internal happiness that is one tries to teach kids these days.
Well, personally, if such parents are sending the kids to plastic surgeries, the government should take the kids away because obviously the parents aren't giving them a right upbringing.
All right.
See, I will tell you, we find at 14 and 15 years of age, kids, male children, they are coming with the problem of gynecomastia, which is male breast. We find it very early nowadays because of a lot of stress, hormones. We have hormones in the foods also. You find estrogens given to the chickens for the early growth. We find that because of these reasons and the stress level, even at the school, people are coming now at earlier age, maybe a decade early, when they used to come maybe 5 or 10 years back for the male breast problems. We definitely don't do it in 14, 15 years. We ask them to come after 18. But they do have a problem of wearing t-shirts and mingling up in the community with their friend circle. They are teasing them up.
Zorin, you wanted to respond to that? Any comments on that?
I do. Well, first of all, I blame the parents for that because the kids aren't active nowadays and parents basically are not letting kids be active. Everyone's on their tablets, on their computers. So naturally it's going to be a sedentary lifestyle. And what are male breasts? But it's basically, yes, there's a hormonal reason, but it's also excess fat. So instead of parents neglecting their kids and letting the eyes and the television and the internet raise them, why not send them to a gym or make them exercise from a young age onwards?
They are doing, and then they are coming with this because once the size is increased, it doesn't go away only with exercise. It becomes a laxed tissue.
Prevention is better than the cure, right?
Prevention should be the foremost. Definitely, I agree to it. It should be the foremost. Even if with this problem, you cannot jump for surgery before 18 because it is unethical.
All right, Zorin, we'll give you the final word because we have a lot of viewers who want to come into jump into this conversation. Any final words from you on this subject?
I would just say that, at the end of the day, think about why you're getting surgery done, and remember, it's just a selfie. It's just a way of expressing yourself. It's not the be-all and end-all of your life. Strive for artistic beauty if you can, but at the same time, realize when to draw the line. And there are a lot of things you can do before getting surgically enhanced.
All right, I'm
Otherwise,
sure.
you don't want to be a Kardashian sister.
It should be the last thing, actually.
Actually, surgery perhaps should be the last resort. Thanks very much, Zorin, for coming in and with your insightful comments. And we look forward to having you on joining in the conversation on India Post Live more often. Thanks very much for coming in. So you, the viewer, can of course join in to the conversation on India Post Live, India's first online news conversation portal. IndiaPostLive.com is the website. You can go log in, post your video comments over there. You can also hashtag India Post Live to your tweets and join in the conversation. Dr. Chaudhary, as far as kids under 18 goes and parental pressure goes, do you often see that it's not just about a deformity, it's perhaps parents' obsessions with getting the best for their children that is perhaps pushing them to a point where there is no point of return?
Every parent wants their kids to be the first in the class, so they want their appearance also to be the best. So that might be one of the factors pushing the parental approach to it. But definitely the child must be having something for which he comes out and tell, like, I have a tilted nose, I have a male breast which my friends are teasing, because of which.
All right. In fact, for viewers who just joined in, let's quickly play out for you this new selfie obsession and what it is often leading to in this modern day age. Let's have a look at the story.
If it was drug addiction earlier, it's now the selfie that has become an obsession with the youngsters. The selfie obsession has now been recognized as a mental disorder by the doctors. After spending 10 hours and clicking over 200 pictures, 19-year-old Danny Bowman realized he had not got the perfect picture. The teenager attempted suicide in the UK. This incident has revealed the fault lines in the online social media.
Because of increasing peer pressure now and the social sites and media awareness, most of the patients, they are coming a decade early now.
Indians are not far behind. The selfie and looking good trend is becoming a rage.
I want to change my smile because I often don't smile.
People click to get it uploaded on FB. So yeah, in today's world, everyone wants to look good. They want to look smart, beautiful in front of others. So, and pictures play a very big role in today's life.
I can remove my scars. That would do nothing else. Eyes. It just anything into my eyes. Like make it bigger or something. I make it look broader.
I feel like pics should be more appealing, so I take more and more selfies. So I can take the best selfie on Facebook or WhatsApp.
Plastic surgeons and hair transplant clinics are not complaining either.
Women clients generally we have if we take in a ratio 1 to 10, we generally receive around 1 or 2%. And generally they come for eyebrows if they have a very thin eyebrows or if they have any scarring in the eyebrows.
Good looks matter even if that means simply being online. And it's only a matter of time before the selfie bug bites you if it hasn't already.
All right. We also have with us in the studio Neena Haridas. She's the editor-in-chief of Marie Claire and, of course, the social commentator. Neena, as far as the selfie obsession goes, what would your take be? What have you seen in your career as a journalist who's covered the look side of it and also perhaps the mind behind those looks?
Okay, first, the magazines, fashion magazines, lifestyle magazines and movies were first accused of causing self-image issues among youngsters and teenagers. So now it seems like you are blaming technology. But I think it is a little bit more than the influence of magazines or technology or cell phones. I mean, I always think that this is a generation, this new generation is what I call the I generation. You know, it's self-promotion, it's self-obsessed, self-possessed to a level that is probably unhealthy. And I think the fact that there is technology now everywhere, everybody has a camera.
Everybody, I think, has a digital persona.
Yeah, it
other
has
than
a
their real
camera,
self.
and then to top it all, the fact that there are all these social networks which makes them interact not only with their friends but absolute strangers. I think that is kind of setting this whole issue of self-esteem rather than self-image, if I may say so.
All right, and as far as the self-esteem is concerned, it often is seen that it starts at a very young age. Perhaps, somebody at a latter stage in life would have had a lot more life experience to deal with the various kinds of people. For a child who's under 18 to have a comment that is discouraging on Facebook could be very detrimental to his mental health.
I agree completely, because I think and to some extent, I also blame the parents because the parents themselves are pushing children to an extent where they have to be the best, whether it is in school, whether it's in sport, and a few months ago, I think a couple of months ago, we did a story in the magazine where we were looking at this Miss Universe equivalent of toddlers. And these kids, their entire life is about looking good. They have been told that they have to win the pageant, they have to get the crown, and they start, and the mother of the child starts putting that into that poor child's head who's yet to learn the alphabet. So, how do you expect a child like that to grow up with any self-awareness? I think the poor child is just so worried that she's not going to,
This is heartbreaking, I must say.
Yes,
that
it was a very heartbreaking story. The pictures were very beautiful and cute, yes, but the children were traumatized behind it. And every time they probably lost or didn't win, I dread to think what that child would eventually grow up to.
All right. In fact, let's get in a few other comments. Viewers coming in. Jannat Thapar joins us from New Delhi. Jannat, welcome to the conversation. What would your comments be, or do you have any questions for our experts here?
Yeah, see, I myself click a lot of selfies, and I feel that selfies help us accepting ourselves and our faces. And yes, it is true that parents put in some kind of insecurities. Maybe they have those insecurities in themselves that are carried forward to the child. But selfies, I feel they actually tell us how comfortable we are with ourselves and how well are we accepting ourselves and our faces, and that is good. I don't know why
but that's the positive side of it. Jannat, let me just be the devil's advocate over here and ask you, if you have a whole host of negative comments coming in on one particular picture, how would you feel about that? Wouldn't that be detrimental to your day's functioning? You would be thinking about that one picture and why did you post that, or what should I change about myself? Would you think like that?
Well, okay, this is a weird situation. Yes, I would think about it, and I would think that, what is wrong with me and how should I mend it? And yes, obviously one gets conscious, but going in for a surgery, as you were mentioning it earlier, is not a solution. It just maybe some other things can be helpful, but not surgery, of course.
Absolutely. Surgery, I'm sure, is not an option. But Meena, parents are pushing their kids in. As Dr. Chaudhary was telling us earlier, that there are so many kids of under 18 who are being brought in. And perhaps habits, food habits was one of the reasons, Dr. Chaudhary, you were mentioning, that why often children under 18 have to come in for cosmetic surgeries, because then in the longer run, it would be detrimental to the mental health or to the self-esteem.
Even the lifestyle, which they are more sedentary, so they are not having maybe enough spaces to play with, and they're not having more physical exertion, more focused on, like parents are pushing them for studies, you're not getting good marks, just keep studying or like that. That thing is still continuing, although we don't expect with the changing time that should be there. But it is not only limited to the studies, like even it's coming into their appearance. Everybody, my son looks like this. You can find in the social circles people pointing out.
All right, Nina, would you, as far as parenting is concerned, that perhaps is something where, I mean, in this day of everybody being an individual, everybody being oneself, and you become that oneself at a very early age, by what, 12, 13, 14, when by the time you're on Facebook, you are your own self. So parental control is something that perhaps could address this issue, because otherwise this could become an epidemic.
I agree, but it's, well, I think before we ask for parental control, don't you think the parents themselves must get some kind of therapy? Who are the parents of this generation? Probably people like us. Yeah. So now, if you were to push the child to this perfection, I think it is probably the parents who first must face the reality that all children are not, I mean, I think it's politically incorrect or insensitive, but not all are equal. I mean, some kids are better at something else, and so there are others who are better at other things. But the fact is that I don't think parents are realizing that the way they push the kids is what is pushing the child further into this whole, dark hole. I mean, I find this selfie thing rather amusing. I mean, I don't think it's going to be such an epidemic where we are going to face.
Well, this kid in the UK tried to kill
yes,
himself.
Yes, I read about that. Yes, I read about that. That must be an extreme case, but I really don't think selfie is. I mean, this whole selfie thing became, I think, thanks to Obama and Ellen DeGeneres or whatever.
More of a fear of getting rejected. That rejection which they are going to face at that time when they are just entering the college or near completing their schooling. At that time, they are not sensitive enough to bear that kind of pressure of rejection, maybe.
Yes, but 10 years ago, we faced that kind of insecurity when we were entering college, because it was so mandatory that we get straight A's. You could not go back home and say that you flunked math. Yeah. So I think it's just a little bit more, because this generation, the generation that
I think every generation has its problem. I mean, there was a generation.
So I think all of us are responsible for what is going on with the new generation, and it is not the poor kids to be blamed. Right. And to add to that, we did not have all this Facebook, Twitter, Flickr, all those things. It's this whole social existence. Whereas these kids, most of them, and I have members of families who only have that existence. They don't know what it is to go out and meet real people and play with real kids. So even if they have to have conversation with their besties, they would rather do it digitally.
Yes, because I mean,
I ate this.
You order something and you click a picture of that on Instagram.
My aunt gave me this lipstick, so I have a niece who is.
Facebook everywhere.
All right, but it's a reality that we have to live with and perhaps adjust better. Thanks very much, Jannat, for coming in. We look forward to having you on the conversation more often. You too, the viewer, can also join in the conversation. IndiaPostLive.com is the name of the website where you can go in and log your comments. Hashtag IndiaPostLive is, of course, for your tweets, so you can jump into the conversation. We're talking about selfies, the obsession with that, and plastic surgeries. A few of our comments that have come in online. Ritvik Narayanan writes in, plastic surgery costs money, is painful, and creates permanent changes that can never be completely reversed if that is later desired. Is that true? That you can't ever go back to your original self, can you?
No, because of the scarring you can't, because the plane is changed, every aspect of the surgical part of it has changed. Now it is not that natural. And looks.
As far as the monetary aspect is concerned, how expensive is it? Because just to give a sense to our viewers.
See, it might have been expensive for someone, but might not be for the other. It depends upon in which strata you are, how much money you have.
So is it a few thousands, a few lakhs, few crores?
No. It starts with thousands and can end up in lakhs. But the thing is that who is the patient, in which age group he is? Like up to 18, they don't have their own money. Maybe after 24, 25, they start getting the money in hand. After their graduation, maybe. Except few call center employees, they do have early access to money and they come at the early time. But mostly otherwise, they get money from their parents only.
All right, Nina, as far as social media is concerned, I mean, we might say that social media is because it's all changed because of social media, but then it's here to stay. This is how, this is the day and age of social media. So how do we get our kids to adjust better to this new society?
So I have a question to the surgeon who does this, who is willing to do this plastic surgery on a kid who comes to him.
It should never be done before 18 years of age.
So then why is that? Isn't there any medical ethic that you have to follow that you don't do? I mean, some surgeries I understand, orthodontal and nose, the disfiguring aspect, of course they have to be done, and that's not to be seen as vanity. The kids must be given help. But if a child comes or a mother comes, I'm assuming the child comes with the mother or the father, seeking this surgery. Now, what are the kind of surgeries that these kids are seeking? I mean, parents are seeking. I'm not sure. I'm sure it's not. A 14-year-old is always saying that, oh, I wish my nose was different. We all did that.
Yeah. See, ethically, nobody touches the nose before 18.
I mean,
yeah. So I don't think people must be touching it because it interferes with the growth of the nose.
So if it is after 18, so then what I don't understand is that if you are saying kids are coming for plastic surgery, who are the people who are bringing these kids to the surgery? Obviously, they are not paying for it.
No, but rather than address the lifestyle issue that perhaps we've been talking about the male breast, so to say, and a lot of kids because of their eating habits and the fact that food also contains estrogen in many fast foods, that kind of a phenomenon is happening. So perhaps rather than addressing the lifestyle issue, we're not taking the best preventive, but we're going in for the cure.
Yeah, so I want to, what I'd like to understand is who are these kids and who's bringing these kids to the surgeon?
They are always brought by their parents
so
if they are
isn't
before
that
18
where
years of age.
we start when you say how do we deal with this problem? Isn't that where we start? Aren't the doctors themselves responsible for encouraging this
I don't
trend?
think doctors will ask them to go under the knife before 18. They often
well,
tell
if you're
them
saying it's happening, then
we
somebody
are saying
is...
they are coming with this. We are not operating on them. We are always telling them this is not realistic and you should come only once the complete growth is there. Maybe you should come after 18.
Okay.
Because ethically it is not good to touch things like nose or breast before 18.
Right.
We always tell them to come back after some time, maybe to come at 16 so that we can prepare for the surgery on 18 year of age.
Okay.
We always tell them to go back and come after some time. Simultaneously, we tell the parents to have a counseling done if it is interfering in their studies or normal activities. We always do that.
All right, Nina, as far as social media is concerned, final comments because we're running out of time, but with the schooling system, parents, I mean, this is the day and age of where both parents are working. So how does one understand the phenomenon of social media? How does one better prepare their child for it? And how does one take care of that?
Well,
can the schooling help? Can teachers help?
I think it needs it's a question of complete being with the child in part of his life. Most parents are themselves too busy with the social networking, and they leave their child to a computer or an iPad and expect them to just find their way. So this is it's again the same old, I mean, it's just that only technology has changed. It's the same thing that the parents have to be responsible for what is going on in the child's life. So they have to be there instead of swiping on their own smartphones. Why don't they just start playing with the kid instead? And if technology is here to stay, and of course it is here to stay, make technology part of the game, that's all, and maybe have just be around to see what she's up to.
All right, now, Dr. Chaudhary, I'll give you the final word very quickly. As far as this entire subject goes, any word of advice for any person who's feeling a little down, who's perhaps got a bad comment on Facebook, that everything is fine?
Yeah, the building up of a self-image cannot be just looking like the best actress or a best actor or a best football player. You are as an individual very important to the society and your parents and to yourself. So whenever you feel that you are low, tell your parents, and parents has a responsibility of convincing them that this is a temporary thing and it is not more important than your other things, like if you are at that time a student for that, or if you are a sportsman for in your sports. Only if it is interfering a lot, then you should get a counseling done first rather than jumping to a plastic surgeon. Because if he comes to me, I will send him back to the counselor again. And not just also the parent must get the counseling if they think they are not able to help him out.
All right. On that note, I'll thank the both of you. Thank you very much for coming in. And to remind our viewers, once again, IndiaPostLive.com is, of course, India's first news conversation portal online. And you can join in the conversation over here. Hashtag IndiaPostLive for your tweets. And IndiaPostLive.com is the name of the website. Well, to just wrap up, be yourself. It's easier said than done. But then, what else can we do? Thanks very much for joining us, and hope you join in the conversation once again.